So you might be wondering what your downtime is after this operation. I'd say tell the patient in the first week, probably take off the first week or most of the first week. I generally tell them to drink a lot of water, make sure that they eat a lot of fiber-rich foods or a rough diet, just to make sure that they don't get constipated from the pain medicines we give them. After the first week, we find that patients generally do very well, but there's certain things we don't want to be doing. We don't want to hurry back to running. I tell people to probably not do any kind of exercise except for light walking for the first 3 to 4 weeks. After 3 to 4 weeks, after they've seen me, I may allow them to start doing some jogging, especially if they're wearing their support. Don't allow them to do any kind of push-pull upper body exercises for at least 6 weeks. Once they get about 6 weeks out, the capsules have formed, what that means is that every time we put an implant in somebody, there's a small veil of thin tissue that wraps around this implant, and that's called the capsule. We want that thing to remain soft, we want it to remain in place, and it helps the implant stay in place. Generally the first week we limit them to 5 pounds or less. I generally allow them to pick up maybe 10 pounds in the second week. By about week 3, if they're just moving things like their baby, their young child or whatever, I'll let them do that, but they don't need to be in the habit of doing that a lot. So it's a good idea to have some help around the house. Those kind of things will help immensely in the recovery, and of course allow you to have the best result that you can get.